discussion today. This table is very confusing to understand. I somewhat understood it over the last month during my asthma clinic service. So I'm going to try and simplify it for you. Basically, asthma is categorized into intermittent and persistent models. Intermittent, like the word means, is that something that happens intermittently, right? Something that happens on and off occasionally. It's not something that is affecting with your day-to-day life. So that's usually how we categorize babies into intermittent and persistent asthma. Let's say if the symptoms are only less than 2 days a week, less than or equal to 2 days a week, then we would categorize them as intermittent. But if they are greater than 2 days a week but not daily, we would categorize them as mild persistent. If they are daily, we would categorize them as moderate persistent. And if they are happening for more than once a day or they are happening throughout the day, we would categorize them as severe persistent. Coming to nighttime awakening, so if a child is sleeping and suddenly they wake up due to like shortness of breath, wheezing, or these bronchospasms which are causing cough, then that would be called as a nighttime awakening. So for any child under the age of 4, even if they are waking up more than once in a week, or like they're waking up at all because of their asthma, they would instantly be moved to the persistent category. For a child greater than the age of 5, if their awakenings are less than or equal to 2 times per month, then they would still continue to be in the intermittent category. For a child which is having these is under the age of 4 but is waking up once or twice a month, they would still continue to be in the mild persistent category. If a child under the age of 4 is waking up 3 to 4 times a month, that is pretty much like once a week at least, then they are in the moderate persistent category. And if a child under the age of 4 is waking up greater than 1 times a week, so that would put them in the severe category. But it's different for children over the age of 5. If the child over the age of 5 is waking up 3 to 4 times a month, or let's say once a week, they would still continue to be in the mild category. But if the awakening is happening more than once a week, but not every night, then they are in the moderate category. If they are waking up daily, they are like sometimes 7 times a week, or they are waking up more than once a week, they would be categorized in the severe category. Then coming to the albuterol usage, so if the symptoms are only happening 2 days a week or less than 2 days a week, and the child is using their albuterol rescue inhaler only less than 2 days a week, then they will continue to be in the intermittent category. So albuterol is basically the first line management, correct? And it's not something that you give daily. You only use it for rescue. So like when they're having active symptoms, they use the albuterol and it dials everything down. So if this child is only using that, they will continue to be in the intermittent category. But let's say this child is using the albuterol inhaler or rescue therapy more than 2 days a week, if they are under the age of 4, or more than 2 days a week, but not daily, and not more than once a day, greater than the age of 5, then they would continue to be in the mild persistent category. But if they are using the albuterol inhaler daily, like let's say they are having these symptoms daily, and sometimes they are even using it more than once a day, then they would be in the moderate or severe persistent category. Let's say they are using it several times a day, then they'll be in the severe category. If they are using it daily, they'll be in the moderate category. So it really correlates with the symptoms, right? If they are having symptoms less than 2 days a week, then they will not have to use their albuterol inhaler for more than that. So they will continue to be in the intermittent category. But if there is day-to-day interference, if it's greater than 2 days a week but it's not daily, then there is like a minor limitation and they are in the mild category. If the inhaler is being used basically daily, so they are having symptoms which are more than 2 days a week or like are happening more than once per day, but even if they are 2 days a week or they are happening daily, then they would be in the moderate persistent category. And in the severe category, they will be having the symptoms several times per day, hence, it would be very limiting to their day to day life. So, that's also a categorization. What is the interference with normal activity? So, if it's not interfering with their day to day life or normal activity, then they continue to be in the intermittent category. If there is minor limitation, they'll be in mild. If there is some limitation, they'll be in moderate. If there is severe limitation, they'll be, or there is extremely limited activity in general, they're not able to play, do their day-to-day activities, walk up and down the steps without getting breathless, then they would be in the severe category. Coming to the lung function test, I would put that in a separate video because there's a lot to understand there and it can get confusing and overwhelming. And the last one is the risk analysis. So let's say this child is only experiencing symptoms 2 days a week. Okay, so that makes them come in the intermittent category. But let's say they get hospitalized 3 times every year because whenever they are having a viral URI, whenever it's winter season, their asthma symptoms get so out of control that they need to be admitted. Let's first understand that this, like, symptomatology, whenever you ask a child when they come to your clinic, you ask them over the last 4 weeks. So let's say this child hasn't had any of these, like, severe symptoms or mild or moderate symptoms in the last 4 weeks, but over the last year they've been admitted thrice. Would you put them in the intermittent category? No, because for the intermittent category you'll only give them an albuterol inhaler. That will not suffice the kind of treatment that they require. Hence, they will be in the persistent category. And let's say if their admissions are greater than 4 times a year or more than 2 times in every 6 months, then they of course need to be moved from the mild to the moderate or severe category. They cannot be retained in the mild category. So the risk management analysis is a very subjective analysis and really depends on, where they are at and how, what their hospital admission, if at all it was a hospital admission, looked like, if they required albuterol continuously, if they required oral steroids, if they required to be in the ICU for any period of time. So based off of that, the persistent category categorization will take place. Hopefully that taught you something, and I'll continue to simplify this and the treatment guidelines in the next upcoming videos.